you to please turn on your videos and give me any suggestions, comments. You can stop me in between as well. That works for me. All right. And yeah, another thing, we can also have a proper question answer session at the end of the session, the last 5 minutes. So 2:35 we will have the question answer sessions, because our session will end at 2:40, right? So let's
Madam,
go ahead and start.
before starting, I just want the participants that I have muted everyone. If anyone has any query or want to interact, kindly raise your hand so that I can unmute them. Thank you, ma'am. You can
Yeah.
carry.
Okay, okay. Thank you so much. So, good afternoon, everyone. I am sure that you've had your lunches and you may probably be sleepy. So, and we are going to talk about a very grave situation like cancer. So, I know it will be difficult, but I'll try to make it as interesting as possible. So you know that today why we are doing this session, it's World Cancer Day. That is the reason that we are taking this opportunity to create a little bit of awareness about cancer. We have all heard about cancer, we know what cancer is, but still it is very important for all of us to reiterate the importance of knowing more about cancer, of early detection of cancer, and know what people suffering from cancer have to go through. All right. So, World Cancer Day is celebrated on 4th of February every year, and there are themes related to World Cancer Day, which goes on with the objective of fighting cancer every year, with all the world united together. And that is the reason we celebrate World Cancer Day. The theme of this year is I am and I will. I am and I. Yeah, you muted me. Okay,
I'm sorry.
so no problem. So the theme I am and I will basically means that we need to create a future without cancer, and that we will, and this is the time that we do it. All right, now why is cancer so important? We will take a look at the statistics a little bit. So if we know 10 million people die due to cancer every year. Okay, that is a huge number all over the world, 10 million people. And you will be shocked to know that one third of the cancer out of these are preventable, which means that they need not be having cancer in the first place, because it can be easily prevented through various risk factors. All right, so various things that we can do to prevent cancer, we'll talk about it. Another thing is that now when we talk about India, in India, 1 out of 9 people are bound to get cancer in this whole population, which is very true. So if you're 10 of us, one of you are having high chances of getting cancer. This is how high a statistic it is. And it is it's an alarming state of situation, and that is the reason that we need to really talk about cancer. It is the second leading cause of death worldwide. So मतलब लोग मरते हैं, but सब accidents and other things are the first cause, but the second leading cause is cancer, guys. So cancer is actually killing people everywhere. So that is why it is very important for us to talk about cancer. Now, what exactly is cancer? We have very less period of time, and to talk about cancer in half an hour is very difficult. However, I'm going to just throw some light upon the important points, and try to cover things which you don't know. Okay, so मेडिकली तो मैं डिटेल में नहीं जाऊंगी, बट कैंसर ये होता है कि इफ देर एक नॉर्मल सेल है आपके बॉडी की, कुछ अजीब चीजें आप कर रहे हो, जैसे आप टोबैको खा रहे हो, स्मोक कर रहे हो, दारू पी रहे हो, ये सारी चीजें में कुछ केमिकल्स होते हैं which then go into your body. They go into these normal cells, they change the genetic mutation and cause the normal cell to become an abnormal cell, and lead to uncontrolled abnormal growth, which then forms a lump, or which we call a tumor. Okay, so this is how cancers develop. This is true for all cases except blood cancer. Blood cancer में tumor नहीं होता है. Otherwise, this is the process in all the other kinds of cancer. If you don't treat it, this tumor will have those abnormal cells, right? These are called cancer cells. They will start multiplying more and more, and they will start spreading to the nearby tissues, even in the bloodstream, and can spread to any part of the body. Okay, which we call in the medical language as metastasis or malignant tumor. So this is just the medical perspective of cancer. Now, what are the what are the risk factors, like we talked before, कि क्या है कैंसर का कॉज, क्या है, मुझे इतने लोग पूछते हैं. To be very honest, there is no exact cause of cancer found till date. We can only tell which are the risk factors which can increase the chances of getting cancer. All right. So दो तरीके के risk factors होते हैं. One is modifiable risk factors and few are non-modifiable. Non-modifiable means यार वो है, हम उसका कुछ कर नहीं सकते. Modifiable means the things that we do and which are in our control. Let's talk about the non-modifiable risk factors. For example, age. Sometimes many types of cancer become more prevalent with age. The longer people live, the more exposure they are to the carcinogens. So age is one of the factor. Uska aap kuch kar nahi sakte. The second is cancer causing substances. Sometimes we, due to our job or due to other things, we come in contact with things that have carcinogens or cancer causing chemicals. For example, asbestos, lead, so many other things. Even the non-stick that we use, it is not that safe. We should start switching to steel and mitti ke bartan and all of that. Teflon, all these things are seen to be having carcinogens, not completely medically proven, but yes, they do have a couple of carcinogens that are found. Genetics, some people are unfortunately born with a genetically inherited high risk. For example, उनके genes में ही होता है. So if your family, any one of your family members have had cancer, then there are a little higher chances than other people that you might have cancer too. So you should always be cautious and get yourself checked. The immune system, so people who have weakened immune system are at more risk of developing some types of cancer. Now let's talk about the modifiable risk factors. अब इस stage पे मैं पूछना चाहूँ, yeah. At this stage, is everybody comfortable with my speed? सबको समझ आ रहा है? कुछ issue है तो please do let me know. You can always type in the chat. That is very good way of communicating without disturbing the flow of the session. All right. Yes, so now let's talk about the modifiable risk factors. Now, modifiable मतलब हम control कर सकते हैं. अब हम क्या control कर सकते हैं? We can control alcohol. We can control tobacco. Tobacco is the most leading cause or the highest risk factor associated with oral cancer, and not just oral cancer, many other kinds of cancer as well, which are related to head, neck, and face. Okay, so tobacco and alcohol, इसको हम control कर सकते हैं. Being overweight or obese, excess weight has also been linked to an increased risk of developing 12 different kinds of cancer. So maintaining your body weight, proper diet and nutrition, physical activity, all these things, and radiation. Yeah, so if you are getting exposed to ionizing radiation, for example, there are radiologists or x-ray technicians, all these people are a little bit at higher risk, so they should take a lot of care and keep yourself getting checked as much as possible. Then the last factor is infection. काफी टाइप के इन्फेक्शन होते हैं. HPV होता है जिसको ह्यूमन पैपिलोमा वायरस बोलते हैं, उससे सर्वाइकल कैंसर हो सकता है, हॉजकिंस नॉन हॉजकिंस लिम्फोमा हो सकता है, and there are a couple of viruses which can cause cancer as well. So these are some of the causes or risk factors of cancer as we talk about. And अब कैसे समझेगा कि चलो हमने समझ लिया कि risk factors क्या है भैया, हमको इनको avoid करना है. But then what are the signs and symptoms of cancer? How do we come to know that if I have cancer or I don't have cancer? Now, the major reason of cancer being cancer deaths happening is because most of the cancers, or like 70 to 80% of the cancers, are detected at a later stage. जो जिनकी डेथ होती है कैंसर की वजह से, उनकी डेथ क्यों होती है? बिकॉज द कैंसर इज नॉट डिटेक्टेड एट एन अर्ली स्टेज. कैंसर इज प्रिवेंटेबल गाइज, इट इज वेरी वेल प्रिवेंटेबल. कोई भी और बीमारी की तरह कैंसर की वजह से भी आदमी ठीक हो सकता है, दवाई देके ठीक हो सकते हैं, काफी सारे ट्रीटमेंट्स होते हैं, but people die because they do not come to know about the signs and symptoms at an early stage. कैंसर ऐसी बीमारी है जो साइंस एंड सिम्टम्स जल्दी नहीं दिखाती है, काफी लेट स्टेज में दिखाती है. और अगर आप हमेशा खुद को चेक नहीं कराते रहोगे, कॉशियस नहीं रहोगे अपनी हेल्थ के बारे में, तो आपको पता नहीं चलेगा कि आपको कैंसर है. और हम एज ह्यूमन बीइंग्स, आई डोंट नो, वी जस्ट हैव दिस टेंडेंसी टू थिंक कि हमें तो कुछ नहीं हो सकता. We may never get cancer, we may never get COVID. That is why we see people hanging around without masks and without taking any precautions, right? This is a normal tendency. I'm not blaming anyone, but this is a normal tendency that we have in our heads. ये सबको हो सकता है, पर मुझे नहीं हो सकता. इसके ऑपोजिट कुछ लोग होते हैं जो काफी पैरानोइड होता है कि सब मुझे ही होने वाला है, so they take extra precautions. But most of us, we just think that this can never happen to us, but that is not true. Anything can happen to anyone. In spite of all these risk factors, it doesn't mean कि आप अगर तंबाकू नहीं खा रहे हो, आप स्मोक नहीं कर रहे हो, तो आपको ओरल कैंसर नहीं होगा. नहीं भैया, ऐसा नहीं है. Even if you're not having tobacco, you can still get oral cancer. That is how unpredictable it is. It is very unpredictable a disease. The cause, the research is still going on. So all that we can do is take care, get ourselves tested for cancer every 6 months or once a year, especially for women. अभी रिसेंटली WHO ने न्यूज दी है कि ब्रेस्ट कैंसर इज द मोस्ट लीडिंग कैंसर ऑल ओवर द वर्ल्ड इन विमेन. पहले लंग कैंसर था एक्चुअली, एंड विमेन में था सिर्फ ब्रेस्ट कैंसर. नाउ इट इज ओवरऑल. सो इट इज crazy, like, breast cancer is actually preventable, and there are very easy methods to know if you have breast cancer or not. So we can easily do that. You can do clinical breast examination at home. There are many NGOs who conduct cancer screening camps, जैसे इंडियन कैंसर सोसाइटी भी करती है. आप वहां जा सकते हैं. इफ यू आर नॉट अफोर्डिंग, यू कैन गो टू योर फैमिली गायनेकोलॉजिस्ट और योर फैमिली फिजिशियन एंड यू कैन गेट अ मैमोग्राफी डन. तो सबसे पहली स्टेप तो ये है कि आपको खुद घर पे क्लिनिकल ब्रेस्ट एग्जामिनेशन आप कर सकते हो. आपको कुछ भी अजीब लगता है, यू फाइंड एनीथिंग अबनॉर्मल, यू कैन इमीडिएटली गो टू योर डॉक्टर. All right. And even otherwise, women above the age of 40 are recommended to get a clinical breast examination or a mammography done at least once a year. So all the women post the age of 40 must do this. Clinic and self breast examination, जिसको हम बोल रही हूँ मैं, हम घर पे कर सकते हैं. उसको कैसे करना है? तो you just take the 4 fingers of your palm and you start pressing and checking every part of your breast. Check your underarms, your axilla, and if you feel, and बहुत ज्यादा प्रेशर नहीं देना है, बहुत स्लो, like medium pressure देना है. And if you feel any kind of lump, any kind of गांठ जिसको हम बोलते हैं, कुछ भी अगर आपको ऐसे अबनॉर्मल लगता है, या तो आपके ब्रेस्ट की स्किन के कलर चेंज हो रहे हैं, या स्किन का जो भी टेक्सचर है वो चेंज हो रहा है, या आपके निप्पल में से कोई भी डिस्चार्ज हो रहा है, तो ब्लड निकल रहा है या मिल्क निकल रहा है, इवन इफ यू आर नॉट लैक्टेटिंग, देन ऑल दीज साइंस you should always take into picture and go and see your doctor immediately. इसके अलावा ये तो हो गया ब्रेस्ट कैंसर के लक्षण. इसके अलावा what are the other common signs and symptoms that we'll talk about? So if you have any unusual, जैसे गांठ हो गई या swelling हो गई, कोई भी part of body anywhere, if you have swelling or lump, that is one symptom. If you have coughing, breathing, or swallowing, difficulty in swallowing, तो कोई भी इससे रिलेटेड है. कंटिन्यूअस खांसी है जो रुक ही नहीं रही है, 1 महीना हो गया, 2 महीना हो गया, आप सांस नहीं ले पा रहे हो, या आप निगल नहीं पा रहे हो, यू नॉट एबल टू swallow, these are the second signs. Change in the bowel habit, आपका पेट साफ नहीं हो रहा है, कॉन्स्टिपेशन है, या बहुत ज्यादा है, डायरिया है फॉर अ प्रोलॉन्ग पीरियड ऑफ टाइम. अनएक्सपेक्टेड वेट लॉस, आपका काफी ज्यादा वेट लॉस हो रहा है विदाउट डूइंग एनीथिंग. देन आपको fatigue, बहुत weakness है, चक्कर आ रहे हैं बार बार, so that can also be one of the sign. There is any new mole, जैसे कोई मस्सा हो गया या कोई तिल हो गया या अजीब सी कोई चीज है बॉडी पे जो बढ़ रही है या अचानक से आ गई है, and even if it is not paining, that should always be taken care of. If you're urinating and there is blood in your urine or any other color change of your urine, then you should go to doctor immediately. And if there is an ulcer, आपके मुंह में छाला हो गया है जो बहुत दिन से ठीक नहीं हो रहा है, या आपके टंग पे कोई अजीब से मार्क्स है, anywhere in your mouth there is some burning sensation, or any kind of ulcer that is not healing, that और आपके दांत हिल रहे हैं but आजू बाजू के gums ठीक है, all these things can be a sign. And yeah, acidity, continuous acidity, heartburn, or indigestion. So these are few of the signs and symptoms. Hello. Okay, Debrupa, do you?
Yes, ma'am.
Yeah. Okay, is this space fine? Am I going too slow or fast? Is this okay?
No, madam. Yeah, I think all of us are able to connect with you, are able to understand.
Okay, great. So, guys, anybody has any questions or anything, you feel, okay, what is happening? I'm not able to understand. You can just put in the chat, or you can raise your hand, like ma'am said, and then ask your question. Okay, so now we have spoken about the signs and symptoms. We have spoken about the risk factors. Now let's talk about how to prevent cancer. Now, अभी हम लोग इसके बारे में इतना डिटेल में क्यों बात कर रहे हैं? Because cancer is preventable, right? And how do we prevent cancer is you can take care of the modifiable risk factors which I mentioned. And if you're not able to do that, you can get yourself tested for cancer at least once a year. How to do that? Keep getting screening होते रहते, जैसे मैंने बताया, you can go to your family physician, or you can go to the ages. If it is not affording, then you can always go to screening camps, cancer screening camps होते रहते हैं. Visit your dentist regularly, visit your gynecologist regularly, and just be alert of any of the changes happening in your body. All right. So early detection of cancer is very very important. हम लोग की आदत है कि हम चीजें इग्नोर करते रहते हैं, वी कीप इग्नोरिंग दैट. अच्छा ये हो रहा है, ठीक है, चलेगा, ठीक हो जाएगा, अपने आप ठीक हो जाएगा. नहीं, अपने आप ठीक नहीं होता है. यू रियली रियली मस्ट टेक केयर of any of the changes that are happening in your body. Your body is a very good, it always gives you signs. It's really nice. Body gives you signs and symptoms, so please उसे notice कीजिए, and you should keep yourself getting checked. मैं बहुत डिटेल में नहीं जा सकती. आई हैव सो मेनी थिंग्स टू टॉक अबाउट ओरल कैंसर एंड ब्रेस्ट कैंसर एंड सर्वाइकल कैंसर, कि हाउ वुमेन शुड टेक केयर इन सर्वाइकल कैंसर ऑल्सो. इफ यू आर फीलिंग, मतलब अगर आपको शर्म आ रही है, आपको ब्रेस्ट कैंसर के बारे में, सर्वाइकल कैंसर के बारे में बात करने में शर्म आ रही है, या किसी को अप्रोच करने में शर्म आ रही है, तो प्लीज वो सारी थॉट्स अपने दिमाग से पूरी तरीके से निकाल दीजिए. बिकॉज योर हेल्थ इज अ प्रायोरिटी, and you should not think about the taboos and any other things when it comes to your health. Okay, so it is very important. Let's talk about the treatment of cancer. अभी ये सब हो गया, but ट्रीटमेंट कैसे करते हैं इसका, और हाउ डू यू फाइंड इट आउट? लाइक आई सेड, स्क्रीनिंग में बहुत सारे वेज है. जैसे ब्रेस्ट कैंसर के लिए मैमोग्राफी है, ओरल कैंसर के लिए तो विजुअल एग्जामिनेशन ही होता है, सर्वाइकल कैंसर के लिए पैप स्मीयर होता है, which is a very easy method, and it is not that painful. It is a little uncomfortable, but you should definitely go ahead and do it. So these are the three common cancers. Then lung cancer के लिए there are many other tests. So there are many other screening methods. अब पता चल गया कैंसर है तो क्या करना है? So you can always go ahead and get treated from a government hospital. Tata कैंसर इंस्टीट्यूट है. अगर वो नहीं हो पा रहा है, then if you're affording, you can go to a private cancer institute. If the treatment is very expensive, then you can always approach NGOs like Indian Cancer Society, or there are many other NGOs and there are government schemes also who can help you in the treatment. And treatment में बहुत सारी चीजें होती है, बहुत छोटा सा पार्ट होता है उसको भी कैंसर होता है तो उसको निकाल सकते हैं सर्जरी करके एक एक्सिशन, एंड देन देयर आर कपल ऑफ मेडिसिन गिवन एंड यू विल बी फाइन. इतना सिंपल भी होता है ट्रीटमेंट. बहुत कॉम्प्लेक्स भी होता है जिसमें पूरा का पूरा ब्रेस्ट निकालना पड़ता है जिसको हम मैस्टेक्टमी बोलते हैं. कभी कभी दोनों ब्रेस्ट निकालने पड़ते हैं, कभी कभी पूरा एक पार्ट निकालना पड़ता है इंटेस्टाइन का, उसके लिए स्टोमा बैग पहनना पड़ता है. देयर आर सो मेनी वेज, इफ द कैंसर इज रियली स्प्रेड then you really have to remove that entire part so that even a single cancer cell is not left in the body and it does not spread to other areas. Then there is radiotherapy, जिसमें रेडिएशन ट्रीटमेंट देते हैं हाई इंटेंसिटी की. फिर कीमोथेरेपी होती है जिसमें देयर इज अ कॉम्बिनेशन ऑफ वेरियस drugs that are given. These days, these are the three most common ways of treatment: surgery, radiotherapy, chemotherapy. इसके अलावा इम्यूनोथेरेपी भी होती है, हार्मोन थेरेपी भी होती है, जीन थेरेपी भी होती है. ये काफ़ी सारी नई नई चीज़ें आई हैं. सो हम लोग ट्रीटमेंट के बारे में ज़्यादा बात नहीं करते हैं. वी विल फोकस मोर ऑन द प्रिवेंटेबल एस्पेक्ट्स and a little bit on counseling and compassion. Now you see, suppose आपकी फैमिली या किसी में को भी कैंसर हो गया है और वो ठीक हो गए हैं ट्रीटमेंट के बाद में. So survivorship and rehabilitation, it is very important for these people. You have given them, so they have got life, but quality of life नाम की भी कोई चीज होती है. So just living is not important, but quality of life is equally important. And only because they've had cancer, that does not mean that they do not have rights to live a normal happy life, right? So in Indian Cancer Society also we have many survivors and rehabilitation center in which we give them a life of dignity. We give them vocational training. Even for the caregivers, abhi patient का care लेते लेते caregiver also suffers a lot, and that is why sometimes the financially they get drained out. So we give them vocational training in which bag making is done. ये prosthesis जो होता है अभी, for example mastectomy होने के बाद में the woman has no breasts. As a woman you can imagine how traumatic that experience can be. So it is very important that a woman lives her life with dignity post mastectomy. That is why we make breast prostheses which are made out of foam and out of latex, जिसको पहन सकती हैं mastectomy bras के साथ में, and they can lead a normal life. So this is made by the survivors for the survivors. इसके अलावा रिहैबिलिटेशन सेंटर होता है जिसमें people have to really need a positive approach and look at them not with pity but with pride, because they have actually fought cancer and become successful and are leading a normal life. So that takes a lot of courage. Not everybody has it. So the willpower is equally important. इसके साथ साथ काउंसलिंग बहुत ज़्यादा इम्पोर्टेंट है. अगर आप किसी को हेल्प कर सकते हैं तो हमारी हेल्पलाइन नंबर है जिसपे काउंसलर्स होती है. वी हैव 2 साइको ऑन्कोलॉजिस्ट. वो साइको ऑन्कोलॉजिस्ट मतलब दे आर स्पेशलाइज्ड साइकोलॉजिस्ट फॉर कैंसर. दे कैन डू काउंसलिंग ऑफ द पेशेंट्स एंड केयर गिवर्स who require support, who require counseling. कभी कभी इतना ज़्यादा हो जाता है ना, it is a very traumatic experience. So we do have counselors who can help them, who can calm them down. They are professional and they can give them psychological counseling. So you can go to our website and check the number and press 2 for counseling service, press 1 for counseling, sorry. So yeah, and I just want to say that please don't consider cancer as a taboo. Cancer हो गया मतलब that कैंसर के टैबूज के बारे में हम बात कर लेते हैं थोड़ा सा. कैंसर छूने से नहीं फैलता है. You can hug the person who has cancer. You can stay with the person who has cancer and take care of him or her. Cancer, I mean, फिजिकल रिलेशन से नहीं होता है स्प्रेड, और भी कोई कंडीशन से स्प्रेड नहीं होता है. यू शुड, देयर आर चांसेस, बट यू नो दैट डजंट मीन दैट यू ब्रेक द रिलेशनशिप कंप्लीटली. देयर इज कैंसर मोबाइल फोन यूज करने से स्प्रेड होता है. ये सारी स्टूपिड से टैबूज हैं जो स्प्रेड हो रखे हैं. जीन्स पहनने से कैंसर होता है यार, दुपट्टा नहीं लेने से कैंसर होता है, ऐसी बहुत सारी स्टूपिड चीजें भी मैंने सुनी हुई है. So please do not listen to them, and be informative, learn about it, talk to the doctors, talk to some professionals and experts, and then make your decision. और फिर अपनी राय बनाइए. ये फालतू के लोगों के बारे बातों में मत आइए, because that just spreads hatred and taboo for the people suffering from cancer, and they really shouldn't suffer anymore because they've done it enough. Just 2 minutes, I'm going to take and talk about tobacco and oral cancer and COVID. I think that is very important. So, if you want to quit smoking, because I think you all are students, and that is why I'm going to focus on this fact that how smoking can cause cancer. And I know how cool smoking looks when you're doing it with your friends, or how you want to fit in the group and not feel left out. That is why you start smoking sometimes. And I understand where you're coming from, because I've been through that stage. So it is very easy to start smoking, and it is very equally easy to become an addict, but it is very, very difficult to quit smoking. Okay, so if at all you are smoking and your family doesn't know about it, it's okay. I'm just going to tell you that having the will to quit smoking is the most important. First of all, if you do not have the will to quit smoking, then nobody is going to help you, or no, even if anybody helps you, they you will not be able to quit. So your willpower कि मुझे भैया छोड़नी है सिगरेट, या मुझे तंबाकू छोड़ना है, ये सबसे ज्यादा important है. So how do you do that? You remain active as much as possible. Hydrate yourself, drink water whenever you feel your mouth is dry, yeah, you have a craving. You can go for walks, long walks, or start running also. If you have that extra energy you want to spend somewhere, you can listen to music. Music really helps. uh, See your favorite series, see friends. I think that really helps me a lot. Spend time with your friends and family. Start dancing, or exercising. And switch to oral substitutes. For example, उसको कोई चीज से सब्सटीट्यूट कर दो, कोई भी अपनी फेवरेट हेल्दी चीज. फॉर एग्जाम्पल, यू स्टार्ट ईटिंग फ्रूट्स इफ यू क्रेव for cigarette, or you the last resort is you also get nicotine chewing gums, so you can start using that as well. So yeah, these are few ways which can help you in quitting smoking. Now talk about cancer and COVID. So there has been so many issues, due to COVID. Cancer has really suffered a lot, in the sense सब कुछ बंद था, TMH hospital तक बंद था, because कैंसर इज अ कोमॉर्बिडिटी, और उसमें ऑब्वियसली इम्यूनिटी काफी लो होती है. सो टू डू दैट, TMH was closed, and cancer detection and treatment has suffered a lot. In like it is really bad to see that people have suffered, and cancer related mortality has increased, and even people who had cancer has suffered from COVID. So that I'm just trying to say here that अगर किसी आपके रिलेटिव को किसी को भी कैंसर है, या आपको कोई भी सिम्टम्स है, तो प्लीज गो अहेड एंड गेट योरसेल्फ treated from a doctor by taking proper precautions. Because even if you stay at home, then COVID की वजह से तो चलो ठीक है, but cancer itself might kill you. So COVID will go, but cancer is going to stay. All right, so you have to take proper precautions and go to a doctor and get yourself checked, or continue your cancer treatment. Please do not stop it. So, yes, this is all I wanted to talk about, because we have only 5 minutes remaining, and I want you guys to shoot any questions you have at me, and I'll be more than happy to solve them.
Madam, I have one question.
Yeah.
There are vaccines for cervical cancers which are given these days to kids. So, are they effective?
Okay. Devrupa, actually, the HPV vaccines are there. the vaccine against human papilloma virus, which causes cervical cancer, and it has started in India also recently. However, the research is still going on, ma'am, to know if they are effective or not. And they are, firstly, they're very expensive. So even if you want to go ahead with it, it is expensive because right now it is not reached to the masses stage actually, and only when it is necessary or people who are ready to take a chance, that is when doctor recommend them to go ahead with the vaccination for cervical cancer. So I really cannot comment much about it, but yes, it may be effective, and the research is still going on as of now, though there are no negative cases, so maybe it is effective, but we have not reached a larger population to generalize the statement.
Thank you, ma'am. Any one of you, they want to ask question, please raise hand so that I can unmute them.
Someone themselves.
I think there is no question from anyone.
Okay. Is the chat disabled? I think people cannot put their questions on.
I have written that if anyone was.
Raised her hand. Can you unmute her?
Yes, yes, ma'am. Rupa madam, you can unmute yourself.
Hello. Oh, okay. I think that was done by mistake. No problem. So, uh, anybody else has any questions? This is the last 2 minutes that we have.
Okay, madam. So I don't think there are any more questions. Thank you, madam,
Okay.
for
No problem.
such an enlightening speech. Thank you. From Narula Institute of Technology. With this,
thank you so much, Rupa, and I hope that everybody has enjoyed the session, and I hope that at least some of them heard me and not all of them are sleeping. So yeah, if you have any issues, you have questions, you can go to our website www.indiancancersociety.org, and you can also call our helpline. I've got a question on the chat. Okay, heard that black brow undergarments are effective for cancer. Is it true? No, Sharmila. Again, this is a very weird, misconception, and it is not true. Any color will not affect, but yes, material does. Not any material causes cancer per se, but it can cause any rashes or some other kind of infection. So you should always be caution as much as possible. So I hope that answers your question, Sharmila. Yeah. Okay, then.
okay,
I
madam.
guess no more questions.
Thank you.
Thank you so much.
I'm
Take care
ending the
and
session. Yes, ma'am.
have a nice day, everyone. Take care. Bye bye.